You always hear about the clinical psychologist patient, but you never hear about the clinical psychologist. Clinical psychology is the study of the human mind and its functions. Now you may be wondering, what does a clinical psychologist even do? Clinical psychologists help people deal with problems like short-term personal issues to severe chronic conditions. They have a lot of responsibilities because if they make mistakes in their work, it could endanger their client's health. Most clinical psychologists see between 6 to 8 patients every day. They also have paperwork after every patient they see. To be a clinical psychologist, you have to have a doctorate degree in clinical psychology from an accredited university. You also have to complete a 1-year internship as part of your doctoral program. As a clinical psychologist, you have to be willing to help out and speak in front of the community. Clinical psychologists usually work indoors somewhere and either work with a healthcare team or alone. After working for a company or a hospital for a while, it is common for a clinical psychologist to open a private practice. The employment rate for clinical psychologists is growing because at the moment there is a greater demand for psychological services in mental health centers, hospitals, and schools. If you have a doctorate degree and postdoctoral work experience, you'll have the best opportunities for being a clinical psychologist. The employment rate for psychologists that can help with trauma is also growing because trauma is a large growing field, but it's hard to complete. The best part about being a clinical psychologist is getting to know your patients. They get to watch their patients get better and go on to live a healthy and functional life. There are also many advancement opportunities for being a clinical psychologist. You can open your own private practice, teach, give lectures at universities, be a training supervisor, and even be a professor. Clinical psychologists make between $50,000 to $100,000 a year. But if a clinical psychologist opens their own private practice, they may make more. Sometimes being a clinical psychologist can be very hard, especially when your patients refuse to do the work. Technology has also made it very hard for clinical psychologists to keep their notes private because everything now is put into online medical records. All of the providers who have access to the medical records can see the notes. Psychologists have to write their notes in a way that can protect their patients and keep things private. Being a clinical psychologist is a lot of work, but it is also very interesting. You get to learn so much about the human mind, and you are able to see your patients get better and live a happy life.